Tell us more about the career break and how it impacted your career growth.
Yeah, so the career break. So, like I said, I needed to take care of my family, because as much as the ophthalmic thing was good, it was also a bit, it was taking up too much of my time and away from family. I need a break. It was good. I must say it was good. But it also meant that I needed also to pay bills, and that's how the entrepreneurial part came in and got into business. So I was selling hospital supplies. Opened a company and was selling the hospital supplies. It was a big break. It was an eye opener that there is more to nursing than bedside or OR for that matter, and that you can go far and beyond. That right now I can see that now people are doing many other things, selling scrubs and all, or even that hospital supplies even online. Back then it was not very common. I was able to get into that business. It was pretty good. Then devolution also came in, and there was that part that you could also do it in a bigger scale, that you could also sell it to counties and all. And I think that was one of the most challenging thing for me, when the supplies you sell to hospitals are also not paid, and especially if you sell them to government related entities, or paid pretty late, like really late. And it was pretty stressful at one point. That I also wanted to also just take a break from it as well. But I must say, if the place that I learned a lot in regard to business, that was then. Selling hospital supplies opened up my mind in ways beyond what I would have thought nursing would have been. Interacted with pretty big people in business, and made me even go back to school and do business management, because now I was seeing, this thing was giving us good cash. And I must say, it also gave me the investments we're currently having as a family. Personally, most of it came at that point. It was good. Eventually it also brought a little bit of stress on me, a little bit a toll on me. I also felt I needed a break from it as well. Yeah.
So, would you advise a young nurse out there to venture into business?
I would tell any nurse to venture into business. Business gives you some kind of resilience and a way of just it pushes you to do things that you'd never think you would. I think it's like a rubber band. It stretches you to the point you never thought you'd ever get stretched to, and it takes you places. I must say, if there are other places that I was able to travel to, it was also through business, where you realize I can also sell to other countries, especially our neighboring countries. Kenya is known to be very good with business, and our neighboring countries, most of them do not have the kind of stamina we have. So we're able to sell even to our other countries. I would tell any young nurse, don't feel too small to start. Yeah, business is good. Business is good.
Why did you decide to return to nursing, and how would you say the return was?
Yes, that's another story. So other than the stress that it brought, I thought there's more to life than money and all. I figured I could try something different. So the business was a little stressful for me, a little. It ilinipea pressure kiasi. I felt I needed a break from it. And so I took a break. So when I took a break, I thought I needed to go back to clinicals. Wasn't sure how to go back to clinicals. I thought of home-based. Wasn't sure even how to go back about home-based. And while just figuring out, I also happened to have had friends, older friends, who are many years old. And one of my very good friend who was many years old is a lady who was 98 years. And for some reason, we had a very good conversation. We would catch up easily, and I loved just how she would give me stories of back there, of their days. And then at what point she got really, in fact, she fell. She was not sick, she fell and broke her hip. We're talking about a 98-year-old breaking her hip. And so after getting out of the hospital, I did what a friend would do, go and take care of her. She was a little heavy and her caregiver, who happened to be her daughter, is 70-something years old. So I, as the nurse, it made more sense for me to take care of this lady. For some reason, I got some attachment with old people, and geriatrics ran in my head. And I thought probably this is where I would want to end my nursing career, in geriatrics. And I began doing some research at our home area. Any home that had an old person, I would make a point of visiting like 4 or 5 old people in a day. Remember, I've taken a break from business. I've been out of practice for a while, and now this is becoming very interesting. So out of all the 5 or 4 old people, I would say they all had geriatric problems. Geriatric problems that their people, their caregivers, would always term them as, this is an old age problem. But there are things I found them easy to manage, or if I would just make it clear to their relatives on how to manage this, it would give these old people, a better life, a grace, getting old gracefully. In fact, that was my motto, helping the age gracefully. And that was pretty interesting. So with the research I would do, at any one time, they would either have 2 or 3 chronic diseases that, if well managed, there would not have been a reason for them to die out of it. They would die of anything else, but not really an issue to do with the chronic issues. But the relatives always took it as ni ugonjwa ya wazee. And I thought I should probably venture into geriatric nursing. And I tried. I realized, oh my, it's easy to do the nursing, but it will take money for me to take care of them. I also realized that there are very few people who are willing to invest in the old, including their relatives. Then we are Africans, remember? We do not take our people to homes of the elderly. We'd prefer to take care of our old people at our own homes, but I had seen that gap. They're at home, yes, but the care is not good. But they're also not willing to give someone else a chance to go and take care of them. They feel it's too expensive for an external person to come and take care of their people. 1, it's too expensive. 2, these are our people. This is my grandma. This is my mother. Why do you want to come and take care? It's my responsibility to take care of my mother, my grandmother, my great grandmother. But that care is substandard. So that would mean I will then need resources to not only make known this is an issue, but also go ahead and create awareness. And after I've created the awareness, how do I bridge this gap? I needed some resources. I realized it's true. I can do the geriatric nursing, but I will need resources for it. Now, that is what I didn't have. I didn't have the resources for it. But I figured probably if I have another course that would give me not just the resources, but ways on getting the awareness a little easier, probably that would be it. Yes, that's how I got out of the business and got back into clinical. Yeah.
Let's talk about specializing. Why did you choose critical care?
Yes. So when I realized geriatrics might not give me what I wanted, the next closer to that was critical care. As much as critical care would look at it as a patient who could be an adult, a normal adult who is not very old, but it was giving me a bigger perspective of the care I needed to give to not just geriatrics, but even the greater population. But it would mean that the geriatrics are taken care of there. So I went for critical care. I didn't know exactly what it entailed at that point, but I knew it would take care even of the geriatrics. Yeah, that's how I got to critical care. It was like a little bit of a step down from what my mind was telling me. It was a better step down. Also looking at the job market, geriatrics, where will I get the practice for it? Critical care made more sense. And I also still foresee that it would give me what I need to go back to the geriatrics, where I think I would want to retire to. Yeah.
What are the requirements for specializing in critical care? How long does it take and how much does it cost?
Yeah, so with critical care, nothing much. You only need to have done your general nursing and practice at least for 2 years. Don't need much. You only need to have your license. At least you have to have a license. Having practice for at least, most schools would ask for having practice for at least 2 years as a general nurse before you get to your critical care. My time, we did it for 1 year. Currently in Kenya, it's being done for 2 years. Again, my time, we're paying around 260 something thousand. Now with the 2 years, I want to believe it's a little more. I'm not sure how much, but I want to believe it's a little more. However, with the 2 years, it also comes with a more coursework, but also more units that for us who did for 1 year never had. I understand right now they're also doing a little bit of oncology in it, as we had very little of oncology in critical care. I also understand they're doing a little bit of teaching in it, as we never did. We did very little of teaching. And I also think they're also doing a bigger chunk of obstetrics in critical care, as we did minute of it, but there's a big chunk of obstetrics in it. So yeah, the 2 year might be giving them, will be giving them a pretty broad range of critical care patients. I think I would tell nurses to do. Of course, right now in Kenya, it's a flooded area, but anyway, there's always a niche that one could speak. Critical care has a pretty wide niche one can take, from evacuation, from ambulances, to hospitals, to home care. I mean, to teaching. It's a pretty big and broad niche one could take. And yeah, I think it's a good course. It's not very easy in regard to coursework. One needs to have a pretty good stamina of just the coursework, but it also makes you have some autonomy of why you do what you do. And like the general nurse, there's a lot of do this, do that, do this. In critical care, there's autonomy. You are able to assess a patient and intervene. As much as you'll involve the doctor, you have a say. In general nursing, as much as there's a little bit of say, it's pretty limited. I think any critical nurse, I would say they're very good. Most critical nurses are very good. They're well detailed. They would take care of a patient head to toe easily. Yeah, it's a good place.
How would you say specializing has transformed your career?
Yeah, I think critically now. Not just for a patient, I think even in life. I want to know the why. I want to know the why of everything, not just why we're giving this drug, not just why didn't the relative come, why didn't the doctor do this, why did the doctor think of this, but also think why are we not being given the best of coursework at school? Why is the coursework limited to this level? I mean, I think the critical care has made me want to know more. It has made me see how much I do not know, and I want to know more. Yeah, there's so much I do not know. I want to know. Yeah.
What are your career highlights that you would like to share with everyone?
Career highlights. I think the career highlight would be never think nursing is too small. I think there's so much in nursing one can be, from academics to clinicals to classwork, and you don't have to be one. You can be all of them. There's no limitation. I think I've just seen that. Right now, like I was at one point in an OR, I was in business, I am in critical care right now, and I foresee being somewhere with geriatrics. I think one can be anything. Never limit yourself to anything. But there's no limit to what one can be. And even now, as we see, there's a lot of chronicles to out of the country. Also realizing that nothing is so universal. Like you do not have to be here in Kenya. You can practice it from Somalia to Chad to America to anywhere. Nursing I think it's one of the careers that you can be anything and you can go anywhere. Yeah, it is such a good place. I would say it's such a good place to be at. Yeah.
In a minute, would you give us a parting shot?
Yeah. Who is a nurse? We have been called jack of all trades, and I would want to make nice out of it. Be a nurse of all trades. You can be anything, anywhere, because you can be whoever you want to be. There's no limit to it. I would tell anyone who wants to be a nurse, please go ahead and thrive. Please thrive. Yeah, there's no limit to it. Yeah, I am a happy nurse.